Coming up, hiring freeze. Syracuse University taking action to cut costs. The pandemic stressing the university's finances. Find out how much SU has lost since the pandemic began. Plus, on the front line, CitrusTV speaks with an SU student working as an ambulance EMT in Brooklyn. Hear about how the job has changed since the pandemic began and why the virus presents a unique challenge. And looking toward a brighter future, Governor Cuomo wants to reimagine what New York looks like post-pandemic. The opportunity he sees in one of the state's darkest hours. The CitrusTV News Update starts right now. Syracuse University is implementing cost-cutting measures to help weather COVID-19's financial impact. Good evening, I'm Josh Meyers. In an email to the campus community, Chancellor Syverud announced the university has suffered a $35 million loss since they started responding to the coronavirus. New actions the university is taking include putting a freeze on the hiring of non-essential staff. Many of the university's top leaders as well as coaches will take a 10% pay cut. SU will also put a hold on new construction. The university has also instituted a freeze in salary increases. CitrusTV has reached out to the university officials to find out what this means for the university students who work on campus. We haven't yet heard back. And Syracuse University students will now be eligible for new financial aid grants due to the coronavirus pandemic. As Representative Caco's office recently announced, the money will come from the federal government. CitrusTV reporter Ricky Sayer broke down just how much money could be made available.
Almost $10 million is being allocated to Syracuse University as part of a coronavirus stimulus package. Now, very importantly, using financial aid, Syracuse University is going to have to distribute at least 50% of that to its students. And now that is according to a letter sent on April 9th from Betsy DeVos, the Secretary of Education, to university leaders across the country. Now, we did reach out to Syracuse University to ask how they're going to distribute it. We haven't heard back, and we did that because, according to this DeVos letter, universities have wide discretion, a very significant discretion about how they're going to distribute those funds, and DeVos, though, does offer the guidance in her letter, and I'm going to quote here for a moment, that she wants university leaders to prioritize your students with the greatest need, but at the same time consider establishing a maximum funding threshold for each student to ensure that these funds are distributed as widely as possible.
Thanks, Ricky. SU is giving an opportunity for students who stayed on campus during the pandemic to extend their stay. The university opened summer housing applications for students currently living in South Campus apartments. The application is available through My Slice Housing Portal. Students will be asked how many weeks they plan to stay in on-campus housing. The housing office will reach out to students weekly to ask if there are any changes in the students' housing needs. 2 more COVID-19 deaths today in Onondaga County. County Executive McMahon says both were women in their 70s with underlying heart conditions. He says one of the most difficult parts of treating COVID-19 patients is that families can't visit their relatives in the hospital.
It's the reality that family members can't be with them and really go through that process. And many family members don't get to say goodbye.
There's currently 263 active coronavirus cases in the county. That's up from 351 yesterday. 362 people have recovered. The county will provide a city and town breakdown of recoveries soon. McMahon also says the county is now in full-blown testing mode. They're focusing on areas with more vulnerable individuals and higher population density.
Once we go in there, we're trying to hunt down the virus in those facilities, see if it's still a threat, then we move on to the next facilities.
And right now, Onondaga County is working with their Central New York partners to create a reopening plan for the region. McMahon says that the process is just beginning. There are still more weeks of quarantine ahead. McMahon says there is no hard end date in sight.
So the data is getting better. We need to hunker down.
If the data improves, the county could reopen slowly. McMahon says Onondaga County's data is moving in the right direction because of greater social distancing across the county. And Onondaga County officials are preparing for worst-case scenarios to keep the government running if they get sick. According to a Syracuse.com report, Mary Beth Primo, one of the deputy county executives, is one of the few members of the county executive's top staff to be working from home. This way, if County Executive Ryan McMahon and his team in the office have to go into quarantine, there's still someone who can manage things on the front lines. McMahon and the rest of his team would quarantine together and set up an emergency operations center to aid Primo in running the county. And moving downstate, Mayor Bill de Blasio says ambulance calls in New York City are dropping. In late March, the city recorded over 7,000 emergency calls in just one day. Citrus TV's Connor White spoke to a Syracuse University student who works as an emergency medical technician in Brooklyn about what it's been like to be a first responder in the epicenter of the country's pandemic.
Jake Anderson studies international relations and history at Syracuse University. But ever since spring break began back in mid-March, he's been in New York City on the front line of the pandemic. He says the work can take a toll.
We're trained to handle emergencies, and this is like an emergency that's been going on for 21 days straight. You know, it's nonstop. It never takes a break. I mean, it's a lot. I'm not going to lie to you. At first it was a lot, and then now it's sadly become the regular norm.
Anderson has been working as an EMT in New York for about a year now. He says he's never seen anything like COVID-19.
COVID's such a strange virus that it's not presenting itself regularly. So there's been documentation on how it's been causing strokes and seizures. So we're getting called for one thing, and we're discovering as we get there that it's actually a byproduct of this virus. It is a weird, scary, unknown thing that just rapidly does what it wants, when it wants, to who it wants.
The question is, what does that mean? How do we do it? When do we do it? No.
As local communities, states, and the federal government prepare for the possibility of reopening, Anderson offers a reminder from his personal experience. COVID-19 is unique and deadly.
Can't tell you how many times I've had to go into a house and you expect one thing and you're getting just walking in and discovering like that person's borderline dying. Like, now I got to do something.
Anderson could not stress enough the importance of following medical guidelines like social distancing. He says that following guidelines like these are what can help avoid him having to make a visit to your home. For Citrus TV News, I'm Connor White.
And the number of statewide daily deaths has fallen below 500 for the first time since April 1st. Governor Cuomo announcing today 478 new COVID-19 deaths across the state. Hospitalizations and intubations also ticked down. The government used today's press conference to look towards the future.
Let's use this situation, this crisis, this time, to actually learn the lessons, value from the reflection, and let's reimagine what we want society to be.
The governor also called on the national government to start providing funding to states. Cuomo says up to this point, states haven't received any direct federal funding. Cuomo explained that without federal funding, they will need to cut budgets by 20%, impacting schools, hospitals, and local government. Right now, the governor says federal funding has gone to small businesses.
You shouldn't make us choose between small businesses and large businesses and people who are on the front line.
The governor added that he wants frontline workers to receive hazard pay for their efforts. Locally, the city of Syracuse will be left with a $15 million hole if federal funding doesn't come. And a new report out is shedding light on the state's financial woes. New York State may have spent hundreds of millions to buy medical equipment they'll never need. An Albany Times Union analyst of public records found the state bought $686 million worth of medical supplies. Governor Andrew Cuomo said that amount spent was based on the Centers for Disease Control and Prevention and White House numbers, which show that the numbers of infections and fatalities would be far worse than reality. More people may have had COVID-19 than originally thought. According to new research by the Center for Disease Control, 25% of people may not show any symptoms. This would increase the number of people who possibly have the virus and make it almost impossible to know who. However, scientists warn the numbers may not be accurate. The current COVID testing techniques make it hard for doctors to know if this data is true. At this time, the CDC and other organizations are looking to develop more antibody testing in order to find out how many people may actually have the virus. And turning to some lighter news before we go, men's basketball coach Jim Boeheim is back on the hard courts. Take a look at this video released yesterday. The 75-year-old nailing the long three-pointer. His shooting form is grabbing some attention. Turns out it's a shot that was popular back when Boeheim was a teenager. The video was released by the Jim and Julie Boeheim Foundation. They are holding their 21st annual basketball charity gala this upcoming Saturday. The virtual event will raise money for coronavirus relief. And that will wrap things up for today's Citrus TV News update. For continuing coverage, make sure to follow us at Citrus TV News on Instagram and Twitter. For all of us at Citrus TV News, I'm Josh Meyers. Stay safe and stay healthy.